my support would have been my sister, like my elder sister. So she has always supported me, not only this time, right from the times of UG and 11 12 while I was preparing for AIMS and NEET UG. So from that time she has always supported me, and this time also I gave a attempt in November, and but I was not happy with it, so I was like, yeah, I'll give once more. So she was like, yes, if you are willing to study and if you think you can improve, then you should definitely give it a try, and don't think about anything else. I'm there for you. So I'd like to thank my sister for that. So like I'll start from the beginning. So in first second year, I think everyone should focus on standard textbooks and build their base, because uh, especially for INICET like exam, like they go very heavy on path, pharma, and sometimes in biochem and anat as well. So if you have a good core with your first and second year subjects, so it will help a lot in the exam. Like this time also, people were telling that anat questions were very tough, but in the real sense they were not tough. They were more of application based, or you have to think like, if one thing is this, then another would be this. So, and if you can do that, then the question becomes very easy. And in third and fourth year, I guess you can start by making your own notes. I am a very pro of making your own notes. Like revision notes can be printed notes or like digital notes, because you don't have time at that time. But when you're starting your preparation from third year, fourth year, so you should try to make as much subjects as you can in your own notes. And for that also, I guess sticking to a single source is the most important thing. Like if you're doing a subject from a coaching, then you should follow that faculty only. And even and only if you think after in your internship or post internship that your score is stagnating somewhere and you cannot improve, then only you should go and see some material here or there to improve upon your existing knowledge. Otherwise, focusing on one course, one faculty is the key. And apart from that, many of the students have the tendency to not to go to the clinics and only study in library or in their room with the coaching. So I would advise them to go to the clinics as well, because INICET is improving its question standards, and it's becoming more of a clinical exam rather than a mugging exam. Like this time also, basic questions like side effects of topical steroids. So if you are going to clinics, you self would have used topical steroids at some point of your life, because skin illnesses are so much common and most of them require topical steroid use. So in that sense, you could have ruled out the options, or you could have think that these were the side effects that I have seen or I have experienced. So that makes the difficult questions, like the questions which have come for the first time, which nobody has read, very easy for you to mark right. And then about GTs, I guess if you have time, if you are confident, then you can start giving GTs in your final year itself. Like I know many people who started giving GTs in final year, many of my seniors, and who did really well in INICET exam, but because of some circumstances I was not able to finish my course in time and I was not confident, so I started to give GT in my internship only, and that too in May or June, because I was trying to complete my syllabus and do the PYQs and get confident with the syllabus before starting to give GT, which I thought was wrong from my side. I should have started to give GTs earlier. Even if you are giving one GT in 1 or 2 months, when you are not in a dedicated study time, that also helps, because that helps you to make your pace on how you should attempt every section, because it is now both INICET and NEET are section based exams. So you need to manage your time very well. You cannot dwell on a question for much longer so that the other questions don't get enough time. So you need to make that habit. And also how to review GTs, because I have heard from many students that they spend 1 day, 2 day on just reviewing the GT, which I don't think is a good thing, because after reviewing GT, you have to also read the topics and if you are giving so much time to reviewing GTs, then the time which you could have allotted to reading the topics or moving forward with other subjects is lost. So to make the pace and to get well versed with how to review your GTs, I think giving GTs, starting to give GTs early is a good thing. While you start giving GTs early, you should not focus much on score. Like your score will be stagnant, or sometimes it will go down. But you have to know your technique, you have to know your pace, and you have to improve upon it. The score will improve after some time, or in your internship when you are very serious with your studies. So that's the one thing I would like. And one thing I have seen is that people do very well in GTs. Like there were many people who did very well in GT, but in the real exam they could not get a good rank. So I feel just to target your GT score, ki I want to top GT among my college mates or my friends, is not a good thing. The only target you should have with your GT is to improve your score and see ki what I want from a GT and what the real exam the means. If for example, if we take INICET, if you are getting 160 plus corrects in the real exam, then it's a very good score to get a decent rank. So if you are getting somewhere around 165 170 correct in INICET mocks or GTs, so I think you should be happy. You should not compare much ki others are getting so much. Maybe they are doing some specific questions that are coming, or they are doing Q bank of a particular coaching. That's why they are getting false positive results. So you should not get disheartened with your by seeing that some people are getting exceptionally good GT marks. So I think that's are something. So the last 1 month is very important, I think, for any exam. No matter how good you have studied, if you cannot revise in the last 1 month or keep your calm, so it's not good. So I guess in last 1 or 2 months, it all boils down to your GTs. You give a GT and you analyze it. Which subject is your weaker subject, and so there can be two types of mistakes or means weakness you can come across. One is factual, that you don't remember a fact, or they have asked something new fact which you have not read right till now. Like in PSM they ask some new data, so I guess you should not get bothered much by that. You can make a wrong copy, write it down, and just move on. Like you can revise it 2 to 3 days before exam, and that's okay. You should not focus much on those new updates or data, because there's a very less chance that something like that will be repeated again. And coming back to like the second mistakes which we make is that we are forgetting a topic, or we have not revised that subject. So now again it boils down to how confident are you with that subject. If it is a short subject and you think you are not very confident with it, I would say go with the main notes, because it is a short subject. You can go through your main notes very quickly, and it will give you a confidence ki yeah, now because I have not skipped some parts, so I'm very okay with it. And coming to long subjects which you think you are forgetting, so I would suggest the topics which you think you are really weak in. Like for example, in surgery they ask so many questions from gallbladder or bile duct injuries. So I would say see those topics from main note, and for rest of the subjects you can go through the rapid revision or one shot, whichever you think is suiting to your study style and you are thinking कि हाँ most of the content जो है वो cover हो जा रहा है, क्योंकि you already have read once or twice at least beforehand, so you know कि कहाँ पे कैसा हो रहा है. For me it was like कि most of the subjects I did one shot revision notes, because I was okay with all the knowledge that I had, and I was like कि अब अगर मैं और चीज करूँगा और मेन नोट्स पढ़ने जाऊँगा तो कुछ ना कुछ सब्जेक्ट छूट जाएगा, जो कि नहीं होना चाहिए. बिफोर गोइंग टू एग्जाम इन लास्ट 1 month you should try कि एटलीस्ट 2 बार तो मैं सारे सब्जेक्ट्स को गो थ्रू कर लूँ. मतलब एक बार हो सकता है थोड़ा अच्छे से पढ़ लो और एक बार थोड़ा लास्ट में फटाफट पढ़ लो, क्योंकि इन एग्जाम इट हेल्प्स अ लॉट कि वो विजुअल मेमोरी रह जाए, या फिर अचानक से आपको याद आ जाएगा कि हाँ ये तो मैंने पढ़ा था. तो अगर आप एक सब्जेक्ट पे बहुत ज्यादा फोकस कर रहे हो, बाकी सब्जेक्ट्स को इवन मतलब शॉर्ट सब्जेक्ट को भी आप इग्नोर नहीं कर सकते आईएनएसएट जैसे एग्जाम में, क्योंकि एक तो थोड़ा अनप्रेडिक्टेबल होता है ना, कि किसी साल कुछ शॉर्ट सब्जेक्ट से बहुत क्वेश्चन आ जाते हैं, किसी साल नहीं आते हैं, तो यू कैन नॉट इग्नोर एनीथिंग। एंड लॉन्ग सब्जेक्ट्स में भी सिमिलरली मतलब ये गेस कर पाना बहुत मुश्किल होता है कि किस टॉपिक से आएगा क्वेश्चन। हो सकता है आप जो पढ़ के गए उससे नहीं आए क्वेश्चन, तो फिर मतलब तो इसलिए बैलेंस्ड अप्रोच होना चाहिए। और फिर आपको ये फिगर आउट करना है कि आपको कहाँ लग रहा है लैक्यूना ज्यादा है। अगर लग रहा है बहुत लैक्यूना है तो मेन नोट्स करो, लग रहा है कि नहीं ठीक ठाक है, थोड़ा बहुत रिवीजन का जरूरत है, तो फिर आप वन शॉट रिवीजन टाइप्स जो हो रहा है उस पर भी कर सकते हो। अगर आप पे और टाइम है तो जैसे कि भाटिया ने फिर यूट्यूब पे और अपने ऐप पे भी वो वीडियोस किए थे लास्ट में 3-4 आवर्स के हर फैकल्टी के। तो अगर आप पे लग रहा है कि आप पे टाइम है तो आप वो भी देख सकते हो, क्योंकि उसमें भी आपका फिर उसमें दोनों चीज हो रहा है कि विजुअल मेमोरी भी बन रही है और ऑडिटरी मेमोरी भी बन रही है। फिर मतलब दो फैकल्टी, मतलब सारे फैकल्टी अच्छे, लेकिन दो फैकल्टी जो मुझे भाटिया के बहुत अच्छे लगते हैं, एक तो आप और एक थमीम सर, क्योंकि मुझे एक तो इन दोनों सब्जेक्ट्स में ही सबसे ज्यादा इंटरेस्ट था हमेशा से, मेडिसिन डर्मा। तो मुझे याद है कि थर्ड ईयर में जब थर्ड ईयर शुरू ही हुआ था हमारा, तो भाटिया ने ऑफलाइन क्लासेस रखी थी और थमीम सर आए थे वो क्लासेस लेने, हमारी 3 दिन की थी। तो उसमें एक तो इतने बच्चे आ रहे हैं, क्योंकि थमीम सर का नाम इतना है, तो मतलब बैठने की जगह नहीं हो रही है लोगों को, लोग चेयर लगा के बाहर बाहर बैठ रहे हैं, कुछ को खड़े रहना पड़ रहा है। और फिर सर ने एंडोक्राइनोलॉजी पढ़ाई थी, और फिर उसमें काफी टॉपिक्स ऐसे थे जो सेकेंड ईयर तक थोड़ा कंफ्यूजिंग लगता था कि जब आप पैथ में पढ़ रहे होते थे। पर फिर सर ने जब पढ़ाया जैसे कि कैल्शियम हेमोस्टेसिस या फिर वाटर बैलेंस, तो फिर लगा कि ये तो बहुत ही सिंपल है। और फिर जब उसके क्वेश्चन मैं बाद में भी करता था, मैंने तब पढ़ा एक बार सर से थर्ड ईयर में, और फिर जब मैं बाद में भी क्वेश्चन करता था तो फिर मैं तब भी सर का ही एल्गोरिदम फॉलो कर रहा होता था कि अच्छा यहाँ पे यूरिन ऑस्मोलैरिटी ऐसा है, सीरम ऑस्मोलैरिटी ऐसा है, तो ये होगा ये होगा। तो मतलब ये तो है कि आप जो ऑफलाइन क्लास में जाके वहां पे सीख रहे होते हो वो तो फिर अनमैच्ड ही होता है। और ऐसे ही फिर डरमा में भी सर की एक तो मैंने खुद से नोट्स बना रखे थे, तो मुझे रिवीजन करने में बहुत आसानी रहती थी। तो फिर लास्ट में तो ऐसा हुआ था कि मैं डरमा में इतना कॉन्फिडेंट हो गया था कि मैंने लास्ट में ठीक से पढ़ा भी नहीं उसे, कि ठीक है मैं डरमा तो कर ही लूंगा जैसा भी आएगा। तो मुझे लगता है कि ये दो स्टैंड आउट मोमेंट्स हैं मेरे। और मतलब मैं इसलिए भी थोड़ा प्रेफर करता हूँ कि ऑफलाइन जितना लगा सको, या फिर अगर ऑफलाइन नहीं भी लगा पा रहे हो तो खुद के नोट्स बना के ऑनलाइन वीडियोस देखो, तो मतलब थोड़ा आप मिमिक कर पाओ उस चीज को।